Today's video diary from the World Health Summit 2010 is brought to you by the Faculty of Medicine, Nursing and Health Sciences at Monash University.
Hello and welcome to day one proper of the 2010 World Health Summit, coming to you from Berlin, Germany. Each day during the summit we'll be keeping you up to date with these video diaries that give you an insight into the happenings and some of the personalities here at the World Health Summit. Now, the summit actually kicked off yesterday with an editorial session hosted by the German medical publication Deutsches Ärzteblatt, and that happened at the DZ Bank Chamber next to the Brandenburg Gate. And Monash was very prominent at that, particularly through Professor Steve Wessling, who is the incoming co-president for 2011, and we'll be talking to Steve about some of his issues and ideas in regard to that later on during another video diary. I can tell you that today kicked off with another media conference. It was hosted by James Shao of China Central Television Channel 9, and that'll be beamed around the world. And again, Steve Wessling was also very prominent in that as the incoming co-president. Now, beyond that, we had the first of the two Monash M8 symposium sessions, and today's was Global Health and Healthcare Delivery. That was chaired by Professor Ben Canny, and I'll be talking to him about that later on. And that involved a number of Monash personalities, including Steve Wessling, Professor John Humphreys, Dan Nkaya from Monash South Africa, and Shah Yassin from Monash in Malaysia. And I'll be talking to Shah as well shortly. I can tell you that there are over 1,200 delegates here at the Langebeck-Virchow House for day one of the summit, from some 30 nations around the world. So it's a very cosmopolitan atmosphere. There's a lot of conversation going on, and each day we'll be keeping you up to date, not just with the symposia session information, but also trying to give you an insight to some of the character of this event. Well, we've just concluded the opening ceremony for the 2010 World Health Summit, and you can hear some of the celebrations still going on in the background. Joining me here in our studio is the Deputy Dean for Bachelor of Medicine and Bachelor of Surgery programs, Professor Ben Canny, and also Associate Professor Shah Yassin, who is the Director of Curriculum for Monash Malaysia. Ben, my opening question to you. We had the question at the Deutsche Ärzteblatt function yesterday about the money involved in global healthcare. Steve Wessling raised the point that it was more important to have a skilled workforce. What are your thoughts on that issue?
Both are important, but money without a skilled workforce is absolutely wasted, and we've seen multiple examples of that in the past. So I think where the universities can really get involved here is by making sure we have a workforce that's capable of delivering the healthcare wherever it happens to be. It could be in developed nations, could be in developing nations, and it could be from people from either nations delivering it, wherever it happens to be, who are capable and have the skills to be able to do so. So I think that's one of the really great challenges that M8 can take up, is how do we get the workforce to take advantage of the philanthropy or the government interventions that are occurring to try and help.
Now, Shah, during our M8 symposium session today, you raised the interesting point that there's a lot of mobility in the healthcare sector, and in fact you have overseas students who study either in Malaysia or in Australia, and who then gravitate towards the larger economies and with detrimental impact to their nation of origin. Would you just like to encapsulate your thoughts on that issue?
Yes, I think it's related to the fact that a lot of developing countries train doctors, and then large number of the doctors then move on to developed countries like the States and UK and Australia. The problem is that that actually raises a major issue, in the sense that it's a form of reverse subsidization in the sense that developing countries do all the work, and with the expectation that these students will stay back, but unfortunately they leave, and you can't blame them really, because essentially they are trained to work in a highly technical, in a superb functioning health system. They work in they have been trained in that environment. They have been trained to function in that environment. And then when they go out into the health system of these countries, they find that there's so many issues, and there's a sense that they're not able to put into practice what they have learned. They are not able to they are not able to sort of provide in their conception, in their perception, what is good medical care. And then there's a sense of frustration, and you can see that translated into people looking to move to an environment which is more congruent towards their, what they have learned, and that's a problem. You know, that's a major problem, and that problem is not necessarily across countries, developing to well-developed countries. It actually can be redirected into a situation where there is, you know, that sort of a movement is also occurs from a rural to an urban environment, and the same situation and the same frustration and the same sense of not being able to do what they learned to do comes across, and as a result there's a tendency to move towards urban environment from a rural environment. That was what I was trying to suggest.
Just two of the issues that have been raised here at the summit today on day one. We'll be back tomorrow on day two with a further video diary update. Until then, you can keep in touch with the summit via the summit website, which is worldhealthsummit.org, or via the Monash University faculty website, which is med.monash.edu, or you can follow us on Twitter at Monash_FMNHS. That's all for today from day one. We'll be back here in Berlin with another video diary from day two tomorrow. Until then, bye for now.